My practice nurse was watching an online presentation about the TrueFlex muscle stimulator, and she brought my attention to it, and the first time I saw it, I thought this is something that we need in orthopedics. I've been in it for 30 years. Rehabilitation, getting people back to preoperative strength and mobility is very difficult, and this machine has changed the way I practice. I got on the machine, had a demonstration, I was completely blown away by it. Immediately I realized that this has more potential than just aesthetic rehabilitation. It's a massive potential in getting people back to preoperative muscle strength. The big problem in orthopedic surgery is rehabilitating patients after the surgery. It's time consuming, it's often painful and frustrating for patients, and trying to get that muscle bulk and strength back. When I first became aware of the technology of the TrueFlex muscle stimulator, I immediately thought that this would be immensely useful in rehabilitating patients in the post-operative period and even doing pre-operative, what we call prehabilitation of patients. Well, there's a condition called arthrogenic muscle inhibition, AMI, in which the body automatically inhibits the muscles when it senses that there's an issue going on with the joint. If any pain is coming from the joint, the brain automatically turns off those muscles, and it's very difficult to get those muscles going again. Now, what the muscle stimulator does is it gets those muscles going again, builds them up again while the joint is healing, and that speeds up the rehabilitation. You can rehabilitate the muscles without loading the joint, and that is the big benefit from the TrueFlex muscle stimulator. It's a remarkable machine. No patients have not completed their full course of treatment. We usually give them 4 sessions on the machine. After the first session, the patients are sold on it, and everybody completes their course because they see the benefits of it. It doesn't hurt them, and it gets them back to where they were preoperatively much quicker. I have been advocating to use the machine as a rehabilitation device for many years, and this is now becoming more mainstream. There's a condition called sarcopenia, in which there's muscle wasting. As people get older, their muscles waste, and it's very difficult to get them back to full strength as well, to improve their balance and their gait and their agility as they get older. So the potential for this machine, not only for post-operative patients, but also for the general population in terms of muscle strengthening, improving your quality of life, is enormous. This could really be a game changer. I've been in orthopedics for 30 years. In that time, there have only really been 3 technologies that have changed orthopedics. One would be arthroscopic surgery, the other one would be joint replacement, and the other one is fixing fractures with metal plates and screws. Those are all about 30 years ago. Since then, nothing really has changed, but this, I believe, will truly transform orthopedic surgery in terms of rehabilitation, which is possibly the most important part of the whole process, getting people back to where they were before surgery.